Hey everybody, Dr. Scott here from Elite Chiropractic, and today I just want to discuss with you chiropractic and pregnancy. We've been seeing a lot more pregnant moms coming through the practice lately, and so we want to answer some questions about why is it that why these women are utilizing chiropractic care and why they're seeing the benefits that they are. So to start off, we have to understand the normal function and process of a complex system. I'm going to make it as simple as possible for you guys. So starting off is we have to understand the structure, okay? We have to understand the structure of our back and our spine. And during pregnancy especially, we have to understand the pelvis and the sacrum of the low back, okay? These segments are supposed to be free moving. The camera's flipped here, sorry, free moving, and it's also the pelvis is also supposed to be able to expand, which is incredibly important during the birth process. It has to make room for baby, okay? Well, these motions are what eases the tension around our body and the tension on our nervous system, and the nervous system is the most important aspect of this. The purpose of our nervous system is to perceive our environment and coordinate every single function around it, okay? Our nervous system is what allows conception to happen, allows the baby, the fetus, to actually develop and for this proper motion of our body so that there's enough room for the baby to flip and turn and move during its development stages, position itself head down against the cervix, engaged to begin the birth process that is coordinated by the nervous system, okay? But what can happen, though, in life is that we all have stress in our life, whether it be physical stress, emotional stress, or toxic stress, okay? Food we eat is not always the best. Emotionally, there's so many things going on in our lives, especially during pregnancy. What could go wrong? Do we have the baby room ready? What's happening? We have all these things to think about. Last one, though, of course, is the physical stress that's on our body. Mom, as baby is developing in mom, our posture begins to change because we start to develop baby bumps. Our center of gravity begins to shift forward. The head begins to fall forward. The back begins to arch. Anyways, it's a physical stress that happens to the body. And what this does is it creates a subluxation, a vertebral subluxation, which blocks the body's ability to adapt to these stresses that come on. Okay? So now what happens, now let's refer this back to the pelvis itself. The pelvis is supposed to be free moving and expand to make room for baby to pass through the birth canal. Now, the subluxation comes in. It really causes a shift into the pelvis. It no longer is able to move like it's supposed to, nor is it able to expand like it's supposed to. This also puts pressure on the nervous system. The nervous system begins to tighten up. It tightens the muscles, which then, of course, can lead to a lot of things that expectant moms are prepared for, back pain and all these other things. But that's such a minor piece of it because the birth process is also interfered with it because the nervous system has tension around it. Okay, now we have to look at some other structures to understand what's also going on with pregnancy. Is that when that subluxation is created from this overwhelming of stress, that shift, when we actually look at the reproductive system, especially the uterus attaches to the pelvis in the front, the sides, and in the back of the sacrum. And what happens is when that shift goes on there, it actually creates torque. It actually torques the uterus, which then actually leads to interuterine constraint. It doesn't give baby as much room to move and to grow and develop in the uterus as possible. And then also what happens is that when it comes to delivery time, this torque in there doesn't allow the uterus to contract normally, rhythmically, or as strong as it should be. So therefore we have to lead to interventions, which can also, unfortunately lead to some form of undiagnosed spinal trauma that kind of sets the kid up for a stressful start to life, but that's a whole nother subject that we'll discuss. But in chiropractic, what we do is we remove this vertebral subluxation. We restore normal motion to these joints, to the pelvis and the sacrum, which removes this tension off of our nervous system so that the pelvis, again, can begin to move and expand. The nervous system can control and regulate the onset of birth, delivery, and also help with that healing process after that traumatic event that we go through. And of course, when all things go together and coordinated well, we're at a state of ease, we have a state of comfort, we have less interventions, and we have one heck of a happy new life and a new baby. So anyways, I hope this helps make some sense to you guys, but it's all about removing subluxation, making your body as adaptable to the stresses that we experience every day. So thanks for watching.
Elite Chiropractic. Welcome to the family.